Hello, Dr. Della Parker here, and I want to talk about headaches for a hot minute. So if you're getting headaches, we want to think about the most common reasons that you might be getting them, right? So right now, if you're hearing the PNW, it might be the smoke in the air. So that is a really common cause of headaches right now. We can't really do much about that, okay? The air quality is yuck, okay? So stay inside, try to use air purifiers, things like that. But beyond that, why are you getting headaches? Are they cyclical? Meaning, are they happening every time, like on day 14 of your cycle every month, on day 28 of your cycle every month? There might be a hormonal correlation to that, so keep track of when they're occurring. That generally doesn't, sometimes there's a problem with hormones, but a lot of times there's a problem with your liver. Your liver isn't processing hormones really well. And so we can do a lot about that. Are you drinking enough water? Dehydration is, it's probably one of the number one, it's up there. One of the common causes of headaches that people just don't realize. They're not drinking enough water, and so they're getting headaches. So think about that. The other one that I want you to think about is food intolerances. Are you eating a food that's causing inflammation in your gut and then you're getting headaches? So remember, inflammatory foods don't always create symptoms immediately. It's not like you eat a food and then you get a headache right away if you're intolerant to that food. Your body can create inflammation and it can kind of travel to cause a headache 3 or 4 days later sometimes. And so you're not really thinking, I got a headache. What food did I eat 4 days ago, right? So that could be something that we might want to look into, and we have a food intolerance evaluation to check that out for you. Another thing there is this really cool method of identifying what organs might be dysfunctional in your body causing headaches. So I just want to throw a couple of these things out at you. There's more, so we can get more specific if you are someone who suffers from chronic headaches, but just want to throw these out there. So, we'll just start right-sided headaches. So if you're always getting headaches and they're always on the right side of your head, you want to think about gallbladder, okay? I'm going to steal this page so I can look. There's also going to be, a lot of times a pain right behind your knee. If you push kind of like the top of your calf in behind your knee, a lot of times you're like, oh my gosh, I didn't know I was sore there. But if you push there, it's tender. That's associated with like a gallbladder related headache, right-sided headaches, pain behind your knee. The other type of headache is a frontal headache. Always right here. A lot of times we say check your vision because that could be one thing. But this is frontal headaches are related to your stomach. So stomach function. If that organ isn't working well, a lot of times you're getting pain there. We also see associated point, your pec minor. And so right below your clavicle, you'll feel like a tender point there. If that feels really tender when you push in there, that could be related to stomach dysfunction causing frontal headaches for you, okay? The other one is back of your head. So your occiput, if you're getting headaches back there, maybe you want to think about your thyroid health because these types of headaches are related to your thyroid. I can't remember the point. What is the point? Okay, I don't have a point for that one. But the headache one is the thyroid headache comes on first thing in the morning. So you kind of wake up with it in the occiput region, which is right at the base of your skull there. So those are 3 organ related headaches that we see a lot. There's a few other examples, but I just want you to get to think a little bit deeper about a headache isn't just always a headache. Why are you having it? Don't just throw Advil down the pipe constantly because then you're causing more problems for your liver and stomach. You want to think of why do I have this headache and treat the cause, right? So those are just a few examples, trying to get people to start thinking about treating the cause, not just their symptoms, because when we just throw Advil down the pipes, treating symptoms only, it can get you into trouble down the road. And also you're ignoring what is actually the problem. And if it's giving you these little signs that there's a problem now and we ignore them by just throwing Advil down the pipes, we can be maybe presenting with a much worsening condition down the road if we ignore it. So pay attention to these headaches. Let's figure out why that they are occurring and get them treated for you so you're feeling better. Hope this helps. The other thing I want to mention is, we talked about liver a little bit. the smoke detoxification can really help relieve headaches. So we do have an infrared sauna that is amazing at just detoxifying your system. 15-minute sessions, call us to schedule. They're super easy and inexpensive. The other thing that we're doing this month is Sober October. It's another way to detox your system, right? We have a 10-day or a 28-day option. If you're interested in that, link in the bio to sign up. But that's gonna be awesome to help, hopefully, get you some more water, clear out that liver, heal up that stomach, all those things to get your headaches out the door also. So hope that helped. Talk to you later.